My name is Brittany Gray, and I'm a first-year nursing student at the University of Michigan. My clinical location is the Glacier Hills Rehabilitation Center, and my clinical work was completed on the second floor. Today I will be presenting a patient to you. Patient is a very pleasant 75-year-old African-American female. Before retirement in 2006, Patient was a registered nurse and a nurse educator at a community college. Currently, Patient continues occupational prospects by occasionally seeing a few long-term clients and by supervising counseling interns. Patient is married with 4 adult children and 8 grandchildren. Chief complaint. Patient's reason for seeking care is functional impairment of the right side of her body, secondary to intracranial hemorrhage as a result of a fall. History of present illness. In December of 2014, while walking up the stairs in her home, Patient fell backward, struck her head, and was unconscious for 3 minutes. There was a possible seizure during this time, but there were no witnesses present to confirm this. A CT of her head and body revealed a new hemorrhage on the left parietal lobe, which is the area of previous meningioma resection. Health history. Past medical history. Patient has a history of systematic lupus erythematosus, iron deficiency anemia, type 2 diabetes mellitus, chronic hypertension, chronic dyslipidemia, chronic osteoporosis, abnormal gait related to brain hemorrhage, chronic seizure, carpal tunnel syndrome on the right hand, lumbar stenosis, chronic meningioma, depression, knee pain, hypokalemia, clavicle fracture, arrhythmia, arthritis, cataracts, depression, and headaches. Immunizations. Patient's immunizations are up to date. Allergies. Patient is allergic to bananas, avocado, coconut, and kiwi. Past hospitalizations and surgeries. Patient's chart shows that patient previously experienced breast surgery, appendectomy, abdominal surgery, carpal tunnel release, and meningioma resection. Medications. Currently, patient is on multiple medications as follows: 1 for osteoporosis, 3 for high blood pressure and angina, 1 non-steroidal anti-inflammatory drug, 2 depression and anxiety, 1 diabetes, 1 gastroesophageal reflux disease, 1 for constipation, 1 for seizure, and 1 for lupus. Functional assessment. Health habits. Patient has a history of smoking, but quit smoking in 1973 and has been smoke-free since. Patient reports drinking approximately 2 alcoholic drinks per week in a social atmosphere amongst friends. Patient has no history of illicit drug use. When describing her eating habits, patient reports a normal diet, though she notes she drinks a lot of coffee. Patient also reports having trouble sleeping due to pain related to carpal tunnel syndrome. Patient does not exercise regularly and currently uses a wheelchair, making moderate physical exercise activities of daily living difficult. Psychosocial data. Patient lives with her spouse, and her chart reports that she and her spouse are having marital issues, which could be a stressor that may affect patient's hypertension. Patient initially had a depressive reaction following her fall, but adjusted and now denies having emotional distress. The chart notes that patient may be minimalizing emotional experience as a coping mechanism. Family history. Patient's father has a history of COPD, diabetes, emphysema, and hypertension. Her mother has a history of thyroid disease. Her brother has a history of alcohol abuse and asthma. Her sister has a history of alcohol abuse and depression. Her son has a history of thyroid disease. Her daughter has a history of cancer. Review of systems. I will be reviewing the neurological system and the musculoskeletal system. Neurological is critical to assess because the patient has a chief complaint that mentions that a hemorrhage of her left parietal lobe is the reason for her current functional impairment. Patient also has a history of meningioma and seizures, therefore it is necessary that I assess the system to be sure no new potential problems have developed. I am also testing the musculoskeletal system because as a result of the brain hemorrhage, patient has suffered physical impairment of the right side of her body. Immediately following her fall, she was unable to move the entire right side of her body, but since has worked in physical therapy to regain back some function. Assessing the system will help me know how much progress patient is making in physical therapy and help ensure that no new problems are developing. Neurological. Patient reports having a moderate stress level and having a history of high blood pressure. Patient has experienced stroke in the past and has a history of seizures. In 2009, patient had a tumor in the left side of her brain. Patient had the tumor removed in 2010. Patient denies ever having a back injury, Lyme disease, meningitis, Alzheimer's, Huntington's disease, MS, or Parkinson's disease. Patient suffers constant numbness in her right hand due to diagnosis of carpal tunnel syndrome. Patient also reports some changes in her short-term memory related to the natural aging process. Patient experienced a brain bleed on the left side of her brain this December, causing motor and reflex impairment on the right side of her body. Patient is in physical therapy for this impairment and has made tremendous leaps in her therapy, but still has declined reflexes, strength, and fine motor coordination on the right side. The left side remains unaffected and normal. Patient does not have trouble with balance and reports no decline in overall mental status, no hearing disturbances, and no vision changes. She reports no changes in her ability to feel touch. Musculoskeletal. Patient reports overall decreased musculoskeletal function on the right side of her body due to hemorrhage occurring after a fall she had in December. Patient reports infrequent joint pain, but it is not accompanied by swelling, warmth, or deformity. Patient has a history of osteoporosis, lumbar stenosis, and arthritis. Patient reports limitations in range of motion on the right side of her body, but normal range of motion on the left. She is unable to perform activities of daily living such as walking, writing, typing, and any activity that requires movement of the right side of her body. Patient reports muscle weakness on the right side of her body and normal muscle strength on the left side. Patient also notes that she has no decline in sensory function even immediately after brain bleed. Physical examinations. Neurological. Fulstein's mini mental exam results. Patient scored 5 out of 5 for recall and was able to respond correctly in orientation to time and place. Scored 3 out of 3 for registration and was able to easily repeat the 3 objects I named, which were pencil, glass, and dresser. Scored 5 out of 5 for attention and calculation, successfully counted backward from 100 by sevens. Scored 2 out of 3 for attention when asked to repeat the words pencil, glass, and dresser moments later after the first time repeating them. Patient was unable to recall the third word, dresser, related to memory storage capacity changes and age. Scored a 7 out of 9 for language, lost 2 points for the write a sentence portion of the test and the copy the design portion of the test. Patient was unable to complete these tasks due to impaired motor function in her right hand, which is her dominant hand used when writing. During interview, she was alert and aware of the situation. Overall score, 22 out of 30. Overall mental state is very good. Patient only lost points in mini mental state exam because she was functionally impaired and not because of mental impairment. Motor function. Patient was unable to perform a normal gait and heel-to-toe test due to functional motor impairment of the right side. The Romberg balance test was also incomplete because patient is in a wheelchair and needs assistance to stand for this test. Upper extremity fine motor function was intact on the left side only, but not on the right. Patient was able to touch her finger to her nose, the examiner's finger to nose, and perform rapid alternating hand movement with left hand, but not with right. Lower extremity motor function was intact. Patient could successfully drag her heel down her shin with smoothness and ease. Sensory function. Light touch sensation intact. Sharp touch sensation was intact. When performing methods of evaluating cortical and discriminatory sensation, patient was unable to perform graphesthesia on her right side only due to carpal tunnel syndrome. Patient was able to perform stereognosis on both sides, and patient was able to perform a successful proprioception on her second try. Patient tested negative for both Babinski reflex and ankle clonus. Musculoskeletal. Upon inspection of muscle mass and bone structure, findings were even on both sides with no bulging or asymmetry. Posture was erect, but gait was not assessed due to functional impairment. Scoliosis was also not assessed due to functional impairment, but charts did not report that the patient had any past history or current history of scoliosis. Upon palpation of the joints, there were no signs of tenderness, pain, swelling, warmth, or inflammation. Patient's left wrist, fingers, ankle, and knee, and right elbows all had full unimpaired range of motion, which was free of pain and stiffness. Neck range of motion was decreased, and patient reports neck stiffness after the test. Arthritis pain was reported on the left shoulder, and range of motion was decreased. Right shoulder range of motion was limited. Range of motion was limited on the right knee, and there was no range of motion for the right ankle. Spine and hips could not be tested due to functional impairment that prevents patient from standing. Muscle strength graded on a scale from 0 to 5. Right deltoid 3, left deltoid 5, right bicep 3, left bicep 5, right triceps 3, left triceps 5, right wrist 3, left wrist 5, right finger 0, left fingers 2, hip adductors 2, hip abductors 2, right hamstring 2, left hamstring 4, right quadriceps 0, left quadriceps 4, right ankle 2, left ankle 4. Pertinent systems. Cardiovascular studies from the New York Department of Health suggest that being an older age, having high blood pressure, high cholesterol, and a sedentary lifestyle and diabetes are contributing factors to cardiovascular disease. Patient has some of these comorbidities such as hypertension and diabetes. Patient also reports not exercising and is currently bound to a wheelchair. She is unable to walk or perform regular activities of daily living due to functional impairment of her right side. Because of these factors, the patient leads a very sedentary lifestyle, which contributes to the risk of cardiovascular disease. It is necessary to assess the cardiovascular system to make sure no new heart problems have developed. Respiratory. According to the Office of Disease Prevention and Health Promotion, cigarette smoking greatly contributes to the respiratory disease development of COPD. Patient has a history of smoking and quit in the 70s, but may still be at risk. This site states that quitting smoking may only slow the progression of COPD, but does not prevent it. Patient's father has a history of COPD, and this site mentions that genetic factors strongly influence the risk for COPD. Due to the patient's family history and comorbidities, it is critical to further assess the respiratory system to be sure that no new problems are developing. Thank you for watching my video assessment project for the University of Michigan School of Nursing, and always, go Blue!